Hi, my name's George. I'm a GP in Gipton and I'm the Clinical Director of Seacroft PCN. In a time before MS Teams even existed, and I think before Zoom meetings were widely used, Seacroft was part of the first wave of the population health management approach in Leeds. And we met in Putty Town Hall, and we, probably much like you, were presented with a really phenomenal amount of data to help us understand the needs of our population. And whilst this was incredibly rich and very beautifully explained by some very clever statisticians, I think there's a general sense it was quite overwhelming. And what really helped galvanise us and helped move us on through that data was really just picking one bit and focusing on it. And that bit was the bit that was most unique to us and we felt brought us all together. The bit that we chose was the matrix segmentation graph and chart, because we felt that really demonstrated where the best opportunity was for us to focus our efforts initially. From this segmentation, we could really understood which population to go to first, and we brought that to life by compiling a list of people who fitted that matrix segment, that particular population. And once we had that, and once we'd done some initial work alongside people and understanding what they need, we could really build our team around that and really start to work with people on what they needed. And largely this was people who were already known to services. This was people who were well known to the system. And what we really found was that this data-driven approach found a cohort of people who actually had significantly unmet need. And our wonderful team were then able to work alongside them to really understand what their support needs were and to help that. And we found a phenomenal amount of unmet need and had a fantastic amount of stories of where we've really made a difference to people's lives. The other thing I wanted to just mention was where we felt we could have done better. So I'm a firm believer in the need to measure to improve so you can really understand whether what you're doing is working. And we had a commitment at the beginning within our team that we would record relevant data so that we could really evaluate well. And certainly at the outset, I think we did that reasonably well. I think Graham will talk to you about that. But it's become clearer when we try to evaluate more that despite us knowing that what we're doing is awesome, we probably don't have enough data to really support that with the people who want that type of information. So I think my pearls of wisdom to you would be, within that data, there will be something that is really stands out for you or your area, your LCP. And I'd encourage you to just focus on that and work around that. And also, I'd encourage you to measure for success and really make sure that you've got a robust plan in place and you follow that plan. So I wish you the best of luck. This process has been fantastic for the people of Seacroft and forming relationships within this LCP. So good luck. Thanks.